transformation. I would now like to welcome Dr. Vinod K. Paul, who would be speaking on health systems for New India. Dr. Vinod Paul, a pediatrician by training, has been on the faculty of the Department of Pediatrics, All India Institute of Medical Sciences, New Delhi since 1985 and head of the department for nearly a decade. Professor Paul has been closely associated with India's health policy and programs in various roles for over 3 decades now. India's child and maternal health programs bear the imprint on his research and expertise. He is presently associated with Niti Aayog. I would request Dr. Vinod K. Paul to please come on the stage.
May I request a standing ovation for him because he's spearheaded one of the best programs, which is Ayushman Bharat.
Thank you, esteemed chair, colleagues at the panel, friends. Thank you, first and foremost, thank you very much for the kind opportunity. And I congratulate Amarjit ji for winning laurels. Congratulations, we admire your work and your grit and your commitment. You are a role model for so many of us. Congratulations. 2018 saw a very major path-breaking initiative of the Government of India and indeed the entire nation. For health sector, people say that for health sector, when the history would be looked back 15 years from now, 20 years from now, it might be seen as two segments, before Ayushman Bharat and after Ayushman Bharat. And I like to make a case as to why Ayushman Bharat is a dramatic change in our health system and indeed in the development of India as a nation. Let's first be clear that Ayushman Bharat is not the PMJ alone. It has two components. It has health assurance component, which is more famous because you read more about this in the newspaper. And that goes by the name of Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, PMJ. But Ayushman Bharat also has another extremely important, if not more important component of comprehensive primary health care. And that is to be delivered through a network of health and wellness centers. So this health and wellness center word comes from there. But the mission is truly to establish a comprehensive primary health care. The announcement of Ayushman Bharat was an announcement for both these missions, the PHC and the UHC, so to say. The Honorable Prime Minister launched the health and wellness mission on 14th of April before PMJ was launched. That happened on 23rd of September, about 14 months ago. The point that I'm making here is that when you look at India's journey in the health sector, when you combine our thrust and our vision for comprehensive primary health care, coupled with health protection for secondary and tertiary care, you will see the strands of transformation in this. And that is just the beginning. And that's the case I would make today. And what it means and to move forward. Firstly, a little bit more information on comprehensive primary health care vision. Primary health care has always been a focus of India's health spending and India's endeavor. Indeed, much of the government spending of both center and the state has been on primary health care. You think about it. 53% of the budget truly goes to primary health care, and the national health policy envisages that we will push it to 65%. That's a commitment. That primary health care is so important because it deals with prevention of illnesses through lifestyles, through addressing social determinants, vector control, good habits, good environment, and so on and so forth. And then primary health care deals with first point, entry point health services, which are ambulatory or outpatient, where you don't admit, but you have a transaction. You get your blood pressure checked and the treatment is given. You get cervical cancer screening done and referral pathway is opened up for you. So that's primary health care. The commitment under Ayushman Bharat is to create 150,000, 1.5 lakh health and wellness centers by upgrading our existing sub-centers, typically one each for about 8,000 rural population, and the primary health centers, which reflect about 5 to 6 such sub-centers. That's the primary care unit of 30,000, which has a doctor-based health and wellness center at PHC, and 5 or 6 mid-level provider-centered health and wellness centers at sub-center. Now, why is it different? It was already there. It is different because till now, our government health system was focusing on limited priorities in the primary healthcare system. We were focused in way back in malaria control, for example. Then we were focused on reproductive health and family planning. Then maternal health, child health, other communicable diseases. That's what you hear about national programs. Malaria control, polio, all this was achieved primarily through primary health care. However, if you look at the total need for primary health care, we left out almost 80% of other dimensions to this. And those comprise, for example, the non-communicable diseases, the hypertension and the diabetes, which hypertension, by the way, is 1/3 of all of us on the average. Diabetes, 10%, 12% of us. Huge diseases. Cancer on the rise. We left out care of the elderly. Mental health. This is not there in our primary healthcare system. Eye care, other than cataract surgeries. ENT, palliation. And so adolescent health. We were not doing hell of a lot in the primary care because we had limited resources and we evolved in a certain way. Nonetheless, we achieved our MDGs 4 and 5 and other MDG 6 also, where HIV was controlled through this very system. So it is no joke that it was thin, but it still delivered on high priority. But now India has changed. Aspirations of people have changed. New diseases are onslaught on us, and therefore the vision for comprehensive primary health care is to now cover all conditions, all that it takes for us to be healthy by way of primarily healthy in terms of prevention and promotion, as also to be able to tackle diseases such as hypertension and the diabetes and cancer care, cancer screening, eye care, ENT, care of the elderly in a big way, suicide prevention, good mental health. So all that agenda is now part of our new vision, comprehensive primary health care under Ayushman Bharat. Where have we started? We started with hypertension and diabetes screening and therapy, and screening and treatment pathways for 3 cancers. So this is the new addition on top of the mother and child health and communicable diseases. In due course and not too far in future, we shall have mental health, we shall have care of the elderly, and also other care of the disabled and the other things that I mentioned. So now, instead of limited primary health care, we are now looking at comprehensive primary health. Perhaps, in a way, you would expect a GP to provide primary health care to a UK citizen, and we will do so step by step. We have that commitment. We are on track for building our health and wellness center. We have done 25,000 or so by this date, and we will complete 150,000 of them in time to come. That's the commitment. As we go along, there is a free diagnostic services in a hub and spoke model. We can talk more about that some other occasion. Free drugs, because these are the things on which people spend money and go bankrupt and have out-of-pocket spending. There is a provision for teleconsultation as a way of principle. There is a provision for wellness by way of yoga promotion and fusion with Ayush. So I would say, watch the space. We made a second level quantum shift in our primary health care, and we are on track for this. This has far-reaching implications. If you have to take care of hypertension, just the last bit on this, it is not that you, how would anybody know that he or she has hypertension? It has to be measured. If it is not measured in a farmer in his 50 years of life, and he's hypertensive typically from the age of 30, when would he know that he has hypertension? When he gets a stroke. When would a person of simple means know that he has diabetes or she has diabetes? Is when she would perhaps knock off her kidneys, because these are not visible diseases. And cancers are detected so late that you can do nothing about it. So breast cancer detected through screening mechanisms today has 90% survival. But when it comes late, 10% survival. So primary care would change how we manage and address non-communicable diseases, not when organ damages occur and you need heart surgery, but before that, we address through control of diabetes, control of hypertension, early detection of cancer, good mental health, and that's the vision of Ayushman Bharat, comprehensive primary health care. Now, the other component of Ayushman Bharat is more famous. It deals with coverage of 10.74 crore families. These are the lowest 2 quintiles of our nation. This constitute 20%, 40% of India's population, the lowest quintile and the next quintile. They are the most poor and vulnerable, and they are detected through a system that was referred to by my friend, the SECC, Socioeconomic Caste Census Database System. As you know, it covers 5 lakh for the family per annum. What I want to tell you is that it covers for that family practically everything except transplants and Botox therapy. All cancers. 5 lakhs is a lot of money if spent in a sensible care. It covers all cancers. A rickshaw puller can have both knees implanted, knees, prosthesis put, and still there's money to spare. Stents, accessible to poor people. Newborn care to the tune of 1.5 lakh coverage. So look at it, it covers everything. And these are the people who would have not sought to care. They would not walk into those areas where such care is provided. And if they do, they will have to sell their assets, as you very well know. 7 crore people fall below poverty line because of kharcha related to health. What is our achievement? 14 months down the line, 63 lakh individuals have been admitted in hospitals for care. 63 lakh. What is the population of Norway? 39 lakhs. 2 Norways have been looked after. Every 9 minutes, one patient is being admitted under PMJ in some part of the country. And this has already reimbursed to Indian people, 16,000 crore of money has been saved as a spending collectively of the people. And so much more has to happen. 11 crore cards have been issued. We make payments in 50% instances within 2 weeks, which nobody thought we will fulfill this promise. We'll be even faster than this. In 45 days, almost 70% of payments are made. We have heard about problems, but we haven't heard of a big scam or a big fraud, if any way. Our IT system has stood the test of these 360 or 400 days that we are down with. And we also must remember a couple of important features in this one. One, that it is a federal scheme. It runs in conjunction with the state governments. It's not in isolation. It's a national endeavor. Number 2, it has demonstrated that public sector and private sector can work together. We have public-private sector available to us, particularly in the secondary plus in the tertiary space, engaging them. And engaging them on our terms, which are affordable, which are rational, and they have no whiff of profiteering. We dictate the terms as nation, people, as government. So that is the kind of engagement that we have. 21,000 hospitals are part of this network. We need many more. Half of them are private hospitals. A unique feature is that when a public sector looks after, then the money that accrues to the public sector hospital is kept by the doctors and the hospital administration to improve their own services, having an extra kitty. Out of the 10,000 crore that we have spent, 5,000 crore has actually come back to the public sector, back to the public sector institution. These are some of the design features of the Ayushman Bharat. I'm happy to state that it is a game-changing development, particularly when you combine it with primary health care. So Ayushman Bharat is a game changer. And here are 2 or 3 or 4 reasons. Number 1, we're looking at a holistic change in the health system. From the selective approach, and even in the secondary, there was a selective approach that we will support cesarean section, newborn care, but we were not talking about intensive care for heart disease as a part of public health system or public committed health system. So now it is holistic. It is everything in primary health care is our vision. In secondary and tertiary, it is not just, as I said, maternal care or newborn care, but adult care, gynecological surgeries, cancer, and so on and so forth. So it is a holistic change from a selective change. Number two, we expect huge investment to come because the supply side has to now respond. We need double the number of beds. We need the 5 times the number of specialists. And that's where we want people, civil society, private sector to come forth. We have course corrected the costs and the prices of those packages, and these are 1,395 packages, where we wanted to make a change. So 300 odd package rates have been fine-tuned, where we found evidence that this be the case. We invite private sector to become part if they are not already a part. We invite investment in health infrastructure in a big way, both from the public sector, from the NGO sector, the voluntary sector, as well as the for-profit private sector, aligned to the system that is supported by Ayushman Bharat, namely large volume, modest return. And lastly, I urge that it is a huge leap toward universal health coverage for the following reason. Remember, I said it was to cover 10.74 crore families? It meant how many people? About 52 crore people, or 500 million people. Even without 4 states having joined, potential beneficiaries today are not 52 crore, but 65 crore, because state governments have added additional beneficiaries being paid through their own budget fully, not the shared budget. Today, half of India is insured and assured secondary and tertiary care by way of 1,395 packages, and that's a huge leap towards universal health coverage. Thank you very much.